Okay. Okay, Dr. Guna, are you ready?
Yep.
Let's get this started. Hold on. Okay. Um, just a second. All right. Interesting topic we have for today, right, Dr. Guna? So, okay, good afternoon and salam sejahtera to everybody that has joined us today on our Let's Talk Ladies, which was set up in conjunction of Women's Day this year, which took place on the 8th of March 2021. So I'm Sasha, and joining me today is Dr. Guna Sundari and both of us are from MUC Healthcare. And today we'll be touching on topics like pregnancy during COVID-19, fertility, and periods. And it's all just for us ladies. We have a great lineup for the next hour or so. So ladies, I hope everybody stay tuned throughout the whole show. Also, a little reminder on our second session for tomorrow at 10 a.m. where we'll be touching on everything about breasts. So like breast care, how to care for your breasts, how to get the most out of breast pumping, why breast milk is good, and the one-on-one on breastfeeding, how to get the perfect latch and how to know if your babies have enough milk, and also breast confidence for the younger generation as well. Okay, so for today we have three wonderful mummies who were and is currently pregnant during this pandemic, where they'll be sharing their experiences. If you know, they'll be sharing with us like the things that they've gone through, the pros and cons, or is there any cons that there is being pregnant during COVID-19 lah. So after that, Dr. Guna will be touching on fertility, on how IVF and IUI should not just be the first thing that comes through our minds when we can't get pregnant. And then joining us after that is Elaine, who is the CEO of Enya Technology Sdn Bhd. If you don't already know, Enya is this all-new affordable and holistic lifestyle option for sanitary pads. Yes, sanitary pads, our pads, for periods. It is made with the right balance of passion and innovation paired with technology advances. So Enya sanitary pads are also made with organic cottons. So ladies, you must check them out at www.enya.my. Also ladies, before we get started, please allow me to read out the promotions by Enya themselves, which was specially curated for all of you today. You can buy Enya products with 3 ringgit off when you use promo code ENYA, ENYA, Health21 at www.enya.my. And also Enya offers subscriptions for convenience, offering Enya Basics, which is a type of pad that they have, by just paying for shipping. You don't pay for the product. MUC Healthcare, on the other hand, is also having a special deal for all ladies here today, where you can get a free pap smear, which usually costs like what, doctor, outside? About
70 ringgit plus.
70 to 100, I think. I think that's what I got when I did mine. For any free pap smear for any pelvic ultrasound. And also, if you do not want to have if you're not taking the pelvic ultrasound, then pap smear is only at 30 ringgit, which is a good deal. And the locations for all polyclinic MUCs are in Bukit Bintang, Kajang, and Labu Negeri Sembilan. So if you can see at the bottom of our session today, the ticker will have the mention what I've just will mention the promotions that I've just shared just now. So take a look. Okay, ladies, let's get talking. Dr. Guna, how are you this Saturday?
I'm good. Just healthy lunch, I would assume.
Oh, you had a healthy lunch?
Yeah.
Oh, what did you?
Biryani is healthy.
Biryani. Okay, doctor. It's COVID times and all that, and I think even just chatting amongst my friends, people, acquaintances that I know, even my own parents have asked me. They said, don't you want to have another kid? And then I was like, no. And then they said, yeah, it's not good times during COVID. You can't expect. So I would like to ask, doctor, is it that scary? Is it that scary to be pregnant during COVID? Should there be a worry, or or we can just be normal, get pregnant again, as a summary. Then we get into details.
Okay. So I will start off with a summary of COVID-19 first. Huh? Okay, so COVID-19 was first found in end of 2019 and is still going on. At this point of time, there's about 350,000 Malaysians infected by now.
Wow.
Okay. So it is deadly. It is not as deadly as what everyone thinks, but it can be dangerous. It does have health impacts. Even those who have recovered from it, they do have health impacts. Okay, so the common question asked by most women, the first question would be, are pregnant women at higher risk, right? I'm pretty sure.
Yeah.
Okay, so pregnant women, they are not at any form of additional risk. It's just that when you are pregnant, especially when you're in the third trimester, it is possible that your immune system kind of drops.
Okay.
So when your immune system drops, that's when you get all forms of infections and stuff like that. So based on this alone is why most of them are actually scared of getting pregnant during COVID,
Right.
right? So yeah, it
Right.
can be a little dangerous, but there's all of us are at the same risk levels, I would assume.
Right. Okay. Okay, I understand. So, being in this topic, right? If so, let's say if I'm pregnant, and is there any precautions or any measures that I can take to, because I mean the rest of us are also taking precautions like wearing masks, sanitizing our hands, and all that, the SOPs that's being said over and over and over again. Should there be any more extra precaution for a pregnant lady during this pandemic?
During this pandemic, okay.
Mm.
Um, Basically, when you talk about being safe, especially in this pandemic era, right, the first thing you should always do is follow the SOP that has already been set by MOH, our Ministry of Health. That goes by washing your hands, wearing your mask, try and avoiding crowded areas, and all that comes in under that same family. Lah. Okay, so additional precautions, there's nothing much a pregnant lady can do at this point of time, but
Mm-hmm.
just follow the SOPs. When you follow the SOPs, you can prevent yourself from getting infected.
Okay. Also, should pregnant women get tested for COVID-19 if they are, having doubts or thoughts that is worrisome? Is there
Okay.
anything wrong? I mean, it's still sticking something down your nose and your throat. I mean, there shouldn't be any worry, right?
Yeah, there should not be any worry. I mean, the stigma is there right now. When you poke in your nose, you poke in your throat, it's going to cause some form of bleeding. It is scary, it's painful. Trust me, it's not.
Hmm.
As a medical personnel, I'm pretty sure I've got my nose stabbed a few times by now. So, no, it's not that hurtful. And yes, everyone can do it. Let it be if you're pregnant or you're not pregnant. If you have doubts, you have close contacts, and if you're kind of showing symptoms, just go and get yourself checked to be safe.
Okay. Oh yeah, this is very interesting. This topic actually. This question: can COVID-19 be passed from a woman to her unborn? To her unborn or newborn baby. If I was pregnant and then I have COVID-19, will the virus pass?
Okay. So this thing is still very subjective because there's not much research is kind of supporting this data. But
Mm.
if I'm pretty sure you've heard about this news in July 2020, which is in Florida, a woman
Mm.
gave birth to a pram baby, and the baby happened to be positive for COVID-19.
Mm.
So they are saying it is possible for vertical transmission, especially in utero, which means prior to delivery.
Mm-hmm.
It's still possible, but they are still conducting a few researches. So at this point of time, it is still very subjective.
Right.
Pass it on to your newly born baby. Let's say if you are positive, you are supposed to go under quarantine. Usually we will keep them separated to make sure that they do not pass anything onto the baby. Newborn baby, they are born with poor immune system. They are building up the immune system, in fact. So it is best to keep away, to stay in quarantine, get the baby to be taken care of somebody else while you are safe, and you're COVID-19 free.
Okay, so what you're trying to say is, doctor, it may or it may not happen.
Very
So it may happen to this mom, it may not happen to this mom. It's something similar to what we've been seeing, where some let's say in a household, right? Let's say there's this one particular family member who has gotten COVID-19, but they have been living in the same house, but it doesn't spread. But there
Right.
are some who, this one particular family member that has gotten COVID-19, but spread throughout the whole house.
True.
So
There are
it
many news like that at this point of time.
yeah.
Because we'll be staying in the same room, even husband and wife. In fact, they sleep in the same room. It's just that the husband is infected and the wife is not. So it may happen to some, it may not happen to some.
Okay, understood. Okay, okay. Okay, do pregnant women with suspected or confirmed COVID-19 virus, confirm that they're positive of COVID-19, is there any, like, oh, if I have COVID-19 and I'm pregnant, I have to do cesarean, and it's not, I couldn't give normal, I couldn't do normal delivery, sorry.
Delivery that
Yeah.
So, if you're going to talk globally, which is by WHO, so what they say is that it is not a must.
Mm.
However, in Malaysia, if you are suspected or confirmed to have COVID-19,
Mm-hmm.
you have to go for cesarean section.
Right.
So we have to follow our Malaysian rules. So if you are confirmed and you do have or suspected to have COVID-19,
Mm-hmm.
you have to go for cesarean. There's no way out of it.
Is there a reason though?
Okay, the reason being is that most of the labor suits, they do not have a negative pressure ventilation. So,
What does that mean? Negative, sorry, doctor, negative what? Ventilation, something?
yeah, so when you have when you don't have a negative pressure ventilation, the risk of aerosol spread is significantly higher. So,
Aerosol spread.
yes,
Okay.
would allow spread of this COVID-19 basically. So we don't want it to be spread throughout the delivery suite. We don't want that to take place. So that
Right.
can, you go into the OT where it can, we can control that.
Okay. Also, doctor, okay, the next question about pregnancy and COVID-19. Can I touch and hold a newborn baby if I have COVID-19? Obviously, you can't. But if the mother has COVID-19, like what you said just now, doctor, it's not. It's very subjective that whether it's being passed to the baby itself. So after the baby is delivered, right? Can I touch? If I am positive and baby is not positive, because then after giving birth, you have to breastfeed and all that stuff, nurture and all that. So how does that happen?
Okay, so at this point of time, they will be kept separated. They will be isolated. The safety of breastfeeding at this point of time among symptomatic mothers, it remains controversial. So again, it's very subjective. It's very hard to be very picky about it because this is something new. We are kind of coming up with a lot of research, trying and get the proper way, the healthiest way out of this. So until and unless it's proven otherwise, then they have to be kept isolated. Breastfeeding should not be allowed at this point of time. Direct breastfeeding should not be allowed at this point of time until their second test comes back negative. That is, their swab test comes back negative.
So you're saying that it depends, and it's up to the doctor that is actually currently looking after. So
It's
you
very
can't.
controversial.
There's no finite answer to this. It depends on the person. And do you think it's because COVID-19 is, still in a lot of level? It's still very experimental. Is it?
Yes, true,
Do you
true.
think?
Very experimental at this point of time. That's why there's a lot of research ongoing based on COVID-19, and we did not come up with any conclusion yet.
Right. Okay, doctor. Yeah, I think that's what we have. So as a summary for being a pregnancy and COVID-19, you would say that it's okay. It's still going to be a normal. It's still okay to get pregnant. If somebody has that thought in their mind, then it's go ahead. But just be careful, like how the rest of us are, following the SOPs
Yeah,
and sticking
correct.
to, yeah.
You have to follow the SOP, like it or not, let it be. You're pregnant, you're planning to get pregnant, you have delivered a man, a woman, a kid. You if you follow the SOP, you can prevent yourself from getting infected. In Malay they would say malang tidak berbau. So you do not want to get yourself into a pickle, and then you'll be like, oh man, I should not have done this and stuff like that. Instead of regretting, it's always better to stay safe.
Right.
And even if you were to get pregnant, if you are pregnant, you do not need any additional routine, antenatal care. You don't need it. You just go for the basic ultrasound as suggested by MOH, and you do the basic screening as suggested by the MOH. And that's about it. There's nothing additional that you need it, unless if the doctors that seeing you thinks you need additional care. Till
Again,
then,
subjective.
yes,
Yeah.
again, very subjective. It depends on the doctors that's taking care of you. Some doctors prefers to take additional precaution. Some would be thinking it's not a high risk case, so you don't really need additional care. So depends what situation you're in. At this point of time, it's very tricky.
Okay. Okay. Understand, doctor. So thank you for that explanation, a brief summary about pregnancy and COVID-19. So let's listen in to the actual mummies who were and is currently pregnant. So we have, let me just invite all of them in first. Okay, so let me introduce these three mummies. Like I mentioned just now earlier, one of them is currently pregnant right now, and the other two was pregnant during last year's during COVID-19, basically last year. Okay, they have some interesting stories to share. Everybody has their own experiences. So let me introduce. We have Miss Christina. Hi. Hi. Okay. She's a stay-at-home mom of one now, and she's the one that's currently expecting number two. And she's
Congratulations.
congratulations.
Thank you so much, doctor.
Yes. Okay. And next we have Hema. Hi, Miss
Hi.
Hema. Yes, her
Hi.
story, as far as what she explained to me, is something that I think it's very interesting for all of us to know as well later. And then we have a journalist in house, Miss Shariza, who recently just gave birth to her firstborn 2 months ago in January. And so, how are you, ladies, today?
Good, thank
I'm
you.
good.
Good.
Okay, well, so thank you for joining Dr. Guna and I, and for agreeing to share your experiences. And I must say that it's in my mind, it would be very, it's a scary thing to think about. Ourselves also have to look after. Now the baby is going to come into this time that, vaccines and all that stuff that is not very stable, I would say. Okay, so first things first, we want to know. I think we can start with Miss Christina first, lah. Okay, we want to know from all three of you: was it planned or was it not planned to have this baby?
Hi, Sasha. Thanks so much. Yes, so I really believe my husband and I, we swear by family planning. So yes, we did plan this pregnancy, and you'd probably be thinking in the middle of pandemic, what were you thinking?
Right.
But my daughter turned 2 in August last year, which
Yeah.
is when the situation was a bit calm. There was about 10 maybe cases a day, and it looked really promising at the time. And we had been on birth control for about 2 years at the point when I had my daughter, after I had my daughter. So we did talk about it and we planned it, and we were saying, okay, great. We just moved to a new house, and then we were saying, okay, the time is right. COVID is slowly, calming down, or so we thought. And we were like, okay, so by the time the baby, and we didn't think we'd get pregnant so fast as well. So we were like, okay, it's a good time to have a baby. And then, of course, just as I passed my first trimester, which is like, the safe mark, they say, 3,000 cases, just as we would have it. So now it's back to being scary and honestly, really, really tiring mentally for me. Thinking about having the COVID test swabs are fine, but then what if it comes out positive? What will happen then? You know, will I be able to be with my baby? Will my baby have to be separated from me? What if my husband was positive? And you know, I also have a 2-year old. So it's a lot of things, even though we planned to have the baby. Now that the situation is not getting any better,
Correct.
it is still very, very scary.
Okay. So how about you, Shariza? Was it planned or was it a surprise or was it because everybody was staying at home and then we've got nothing to do? That's what we've been hearing, right? So how was it for you?
I agree with that though. But well, actually, to be honest, it wasn't planned because I just got married last year on end of January last year, and then I knew that I was
Oh,
pregnant
okay.
when I was in 6 weeks pregnant during April. So it's just 2 months after I got married. So it wasn't planned, but after all, I think that well, I'm not young anymore. I was 32 last year, 32 or 31. I think I 32 last year, and so when I knew that I was pregnant during that time, it was actually MCO already during
Right.
puasa,
Yeah.
and then but during that time we didn't know yet whether how dangerous the COVID we don't really know, we don't really so sure yet. I was thinking that, or maybe it's just like the other normal flu, or some sort of virus like before what we have been faced before, but no one knows that it's a pandemic, it's a world crisis. So and yeah, just like what you said just now, I think it's because of MCO and we got not much thing to do. We just stay at home, so maybe that's why there are
I think.
many MCO baby. So yeah, I think it's because of that.
I mean, were there many MCO babies? I mean, you just gave birth, right? Did you have like many mummies at the same time at the delivery room?
um Actually, I deliver at a private hospital, but based on my reading and review, where people review about their delivery experience at a government hospital, yeah, there are many
I think.
MCO babies. And based on my experience as well, many of my Facebook friends, my school friends, they're pregnant as well, and many of them have delivered just like me, and
Right.
others are still expecting. Yeah.
Right. Okay. All right. Moving on to Miss Hema. So, was yours planned or was it a surprise? Can you hear us? Because I can't hear you, Miss Hema.
Yeah,
Okay.
can you hear me?
Yes. Good.
Uh, so called plan, we planned to have a second baby. My daughter was already 1 year old at that time.
Mm-hmm.
So yeah, thought of okay, we can go for a second baby. Then but we didn't expect it to be that fast. My daughter, I took time to conceive after marriage.
Right.
Actually, 2 years
Uh-huh.
after marriage, I conceived her. So I thought it would take time, but no.
It happened.
Yeah, it just happened.
Okay. Okay. And your son was just born. How old is he now? January. Same.
months.
Oh, okay. So about 2 months now. Okay. So I'll ask this next question, right, to any mummies who wants to answer this. Do you have that time when it happened, right? Like what I think Christina mentioned just now. Did you ever had a slight worry of being pregnant? Because like for Shariza especially, you didn't plan this. So I would like to know how, for someone who didn't plan and then like tiba-tiba I'm pregnant. So what was your first thought? And then like Miss Hema and also Christina, like I think Christina, yours is planned, and then Miss Hema, yours is also planned. So going into this, where did you get that confidence? So who's gonna, maybe Shariza, you can answer me first. Uh, what was the first thing? Takut? Was it any sort of takutness?
At first, no, tak takut. Because like I said just now, at first we didn't really know how bad the situation is, how bad the COVID is gonna be, but then weeks by weeks, when this COVID thing dah macam jadi like something very serious where everyone in the world, the cases, the death cases were increasing. So during that time, yeah, I started to feel worry, and there are so many things on my mind. I was afraid of tak dapat nak bayangkan how to say, I can't imagine how it's gonna be when I'm about to deliver my baby. Macam adakah waktu tu keadaan makin teruk, or adakah waktu tu adakah saya dan baby akan selamat from this COVID. So yeah, itu antara saya punya kerisauan lah waktu mengandung. And other than that, I thought that when the government asked us to stay at home, and when bila keadaan ni kita nampak macam senang, it's easy to get infected from one person to other person. So I started to feel like, I can't meet this person, I can't meet this person. So yeah, that are among of my worry during my pregnancy.
Okay. So okay, Christina.
Yeah. So even before COVID, I'm a very paranoid and hygienic mom. My husband makes jokes about it, saying that you don't have to sanitize every baby chair your daughter sits in. So being pregnant in COVID, thinking about having another baby whose immunity is even lower than my daughter now, it's scary in the sense that, am I supposed to be more controlling than I already am? Or do I avoid everyone, exactly like Shariza said? Do I even bring the baby out? And the thing is, I think there is a lot of plus points to it, because now we don't have to plan big gatherings.
Right.
I can easily say, oh, sorry, but I'm not that comfortable with strangers or people coming to the house to see the baby. Because before this, it was almost like an invitation for people. When you give birth, people are like, I'm gonna come over now, and then you're just like, and you've had like this newborn with your hair up and you haven't even showered, and you're like, you want to come over now?
Yeah.
It puts a lot of pressure on the mom and the baby, and especially when babies have schedules, right? They sleep and they want to eat at a certain time. It really messes with your early postpartum, and I'm sure Hema is still going through it as well. So it's kind of a bit, I think it's a bit relaxing now for me to say that, oh, I'm so sorry, but I'm not really comfortable with having visitors, or aside from my family, And also, I'm a big no-no when people kiss my kids on the face. So this is a huge like burden lifted off of my shoulders, and just be like, please don't touch her or him. Like, please don't touch my baby with COVID and everything. And my postpartum present from my sister was just bottles of sanitizer.
Right.
And this before COVID was even a thing. So honestly, a part of me, I'm kind of relieved that I have an excuse. But then another part of me is, life would never be normal, especially for my 2-year-old. Because if I don't go out, she doesn't get to go out, and she's a child. She's not gonna understand that. And there's just so much that she can just look at her baby sibling, right? She's gonna get bored. So I don't know, I guess I'm like 50-50. I'm kind of happy about the fact that I can make excuses, but also not so happy about my baby having to grow up to be an indoor child.
Correct.
Because my daughter loves the outdoor, and we're basically a family that we love to go out. So that would be my only worry, bringing the baby out, and what is it going to be like? Babies can't wear masks, can't sanitize babies' hands because it goes in their mouth. So yeah.
Okay, Dr. Guna, can I just, at a certain time, right? There's when the news announcement about children are not so prone to getting, and there's a reason behind it as well. But there's a clause that say also above 2 years old, and below 2 years old is the one that is higher risk, right? But above 2, you are pretty much a bit safe. So the one that is in high risk is below 2, and the elderly. Remember, in the initial stage, that was said, right? So, is there a reason though? The 2-year-old, the cap at the 2-year-old, sorry.
So the reason behind this is because you look at the maturity of the lungs. For kids, the maturity takes place after 2 years old. There are certain types of enzymes that works in lungs and stuff like that. So that would only become to an age of 2 years old and above, then they are good to go. So until they are 2 years old, they are prone for lung infections, and COVID-19 is respiratory, it attacks the respiratory system. So that's the reason why they would usually cap it at 2 years and above, and they are safe. It works the same way for the adults, I mean, older generation. So it's the same thing. Their immune systems are low, and you don't want to mess with their immune systems, and they already have comorbids, which is the whole thing, the diabetic, hypertension, cholesterol, and etc. etc. So with all these kind of comorbids, it does plunge your immune system down.
Understand. Okay. Okay, Miss Hema, did you have the slight worry of being pregnant during COVID-19? Did you?
In the initial, no, because cases were like much lesser than now. Then at one point when it was kind of serious, especially when I'm working, so manufacturing area, we find that there are lots of cases. Okay, then it was kind of a trauma, like why? Is it safe if I go here? Is it safe if I meet this person? Is it safe I'm coming to work? Yeah, but throughout I was like with mask all the time, if how comfortable or uncomfortable it was. So it's just that we try to save or try to avoid more cases at that.
So you did have to still go to work,
Yes.
being in okay. And also you mentioned a family member was positive of COVID-19. How did you feel at that time, because this family member is quite close in contact with you, and you were pregnant? So at that time, what was did you have like a step by step, okay, how did you process all that?
It was really a traumatized event when we got to know that it was like a positive. Okay, that's the time I was like blank. The first thing I did was I brought my daughter out. I gave her a shower. I didn't want her to get infected. I don't want her to be like involved in any of this COVID. I just like changed her clothes and everything, and I cleaned the whole house. Wherever my daughter is going, I just cleaned everywhere with Clorox. I just kept her safe first. Then only I handled, like, okay, when we waited for KKM to call, going for the swab was even a trauma for me. Bringing my 2-year-old, and on that day, like, she was screaming away, seeing people with masks and aprons, and she was like, no, I'm not going. Then thank God the personnel there also helped us out a lot. Then at that point, I the first thing in my mind was just to keep her safe. So I kept on reading like what else that we can do to keep avoid COVID. So I was like continually giving her vitamins, kind of,
Right.
enriched fruits and stuff. That was my main concern.
Okay. All right. Okay, ladies, I would like to ask, what was the most stressful moment being pregnant during COVID, and for Christina currently what was the one thing that is, top in your head, paling stressful?
I think for me, it's definitely the now limitation to who can be in your labor room. I know it's for a good reason, and they're trying to keep, obviously, your baby safe more than anything. Because the good thing is that I found out with my gynae was that they don't just swap the gynae, they swap the nurses that will be in the labor ward. So everything, and according to my gynae, they have to take a swab every 2 weeks, which is a lot. And
Right.
obviously, because they're handling little babies, and like Dr. Guna mentioned, their lungs, they're so vulnerable. There's so many immune in them that has not even been developed yet. So the thing that I think kind of makes me sad is that my mom won't be in the labor room, because with my daughter, I didn't just have my mom, I had my mom-in-law, my father-in-law was in the room as well. And it was
Wow.
kind of it was nice, because it kind of made it, I don't know if anybody can ever call labor relaxing, but it made the situation much like a little bit less stressful, in the sense that I can hear them chatting, and sure, I'm in like I'm at like 11 out of 10 pain here, but the fact that I can hear them chatting is kind of nice. And also, it'd be nice to have my mom again in the labor room with me, so that is it's a bit sad, because people can go to the gym, but you can only have one person in your labor room with you. So
Right.
pubs are open as usual, restaurants are open, People can have weddings, but so being pregnant now it's pregnancy, but it's not maternity in the sense that I think COVID, especially our government, they have not made it more maternity friendly. And women, they go through so much when they're pregnant and they give birth. And you could make better rules, better regulations. Even at checkups, you can't even have more than one person, which means if my husband and my mom wanted to be in the same room, that's not possible. And the and a lot of clinics don't even let children in. And imagine, if you already have a kid, your kid doesn't experience that, seeing the baby sibling on the screen. It's not ideal, and it's not great. And bringing your kid to an appointment is not going to make a difference compared to if you go to the gym. So
Right.
it's pregnancy, but it's not maternity. And unfortunately, I've been reading so many people when they give birth in COVID. It's just so stressful, having to take swabs, and then having to just, some people, if it's an emergency cesarean, their husband can't even go
Go
in.
in.
Can you imagine doing that? You're literally taking a baby out of your body, but no, you can't have your husband in the room. So I think that is definitely on top of my worry right now, because I don't know if I can do it by myself. I'll be honest.
Of course you can.
Uh, the thing is, when push comes to shove, you can't
Yeah.
keep the baby in, so you're gonna be like, okay, I have to actually just push the baby out.
Out,
There's no way
exactly.
out of it.
Okay. How about you, Shariza? What was the most stressful thing I think you experienced being pregnant during COVID-19?
Okay, to be honest, it's not really stressful actually for me. Alhamdulillah, everything went smooth, and Alhamdulillah, I have a very supportive and understanding husband. And yeah, it's just that during my pregnancy, the most terrified thing for me is I was afraid. I was so worried on how it's gonna be during my labor. I mean, I've been reading a lot of review from other people, other women, when they share the experience about deliver at government hospital, when there are so many, katil penuh and COVID. The husband cannot be with you. You have to do everything all by your own. The husband just boleh hantar you at the lobby, and when you are in your contraction pain, just do it by your own, on your own, everything on your own. So that was actually my, orang kata, my nightmare lah. So then I talked to my husband, and then my husband said it's okay, kita pergi private hospital. So alhamdulillah, I we went to private hospital, and even though we still need to do the swab test, and we both were negative. And then my husband, he was able to be with me from A to Z, and
Nice.
be in the labor room with me. And yeah, is I'm so lucky lah.
So no stress for you. No stressful moment.
not really actually. And
Okay, so that's good. Yes.
it's just that during the checkup, I agree with Christina when she said about the checkup things, where if you go to klinik kesihatan, but I went to check out at klinik kesihatan as well.
Yeah.
No husband is allowed. Everything
Right.
semua kena sorang. And even during your labor pun, husband cannot be there with you. So I think it is something that maybe the government boleh bagi kelonggaran sikit, because kita berjuang untuk mengeluarkan satu nyawa baru, so we need our husband to be by our side. So that's why I deliver dekat private, so that my husband boleh ada untuk bagi semangat semua tu lah. Yeah.
Okay, I understand. How about you, Hema? How about you, Miss Hema? What was the most stressful?
During my quarantine, because of close contact, I missed my checkup. So when missing
Right.
checkup is like a trauma for me. Okay, is the baby safe? Is everything okay?
Yeah.
I
Okay.
delayed my checkup actually for 2 weeks, I guess.
That was like how far along when you had that situation?
I was going into my 7th month.
Oh, almost third trimester lah.
Yeah, almost my third trimester.
Okay, ladies. Thank you for sharing. Okay, if I were to ask one last question, what would you say to someone who is, maybe just like 4 weeks pregnant, or baru 2 bulan, or thinking about getting pregnant but so worried about the whole pandemic right now? What would you say? This, I would say, step of precaution that comes to your mind first thing. Anybody? Would you say anything? Any piece of advice? That's the right word. Yeah, correct.
My first piece of advice would be just get all your family members who can vaccinate, get them vaccinated. Because at the end of the day, pregnant women, children, we are hopping on the herd immunity train. It's not that we don't want to take the vaccine. If I could take the vaccine, I'd be first in line, just so to keep my own kids safe as well, knowing that I wouldn't get infected. So I think the first step is definitely making sure your family members that can get vaccinated, get them vaccinated. You have anti-vaxxers in your family, just be frank and say, I'm sorry, but no coming close to the baby, or because at the end of the day, you think you're safe, but you can easily carry, even people who have gotten COVID, they still carry the virus with them.
Right.
So the vaccine is there for a reason. And if you're if you're 2 months pregnant, or you want to get pregnant and you're worried, hopefully by the time that you give birth, 70-80% of the population would have been vaccinated, and then hopefully you'd be okay, and your baby would be okay. And I'm basically trying to just jump on the herd immunity train, which is a very, very big thing for me, because I really believe in vaccines. And I the first shot that I got the moment I found out I was pregnant was the influenza shot, because it was the season, and this is before COVID was big, right? So immediately I told my doctor, okay, I'm gonna need the influenza shot by hook or by crook. And it's very, very disheartening for me not to be able to take the COVID vaccine, because it's such a big problem. It's a pandemic. It affects the entire world. It's not just a part of our world. So if you have access to the vaccine and you are already queuing up for it, please take it. Don't be selfish. Be selfless for us, for people like me who can't take, and for people like my daughter who definitely cannot take the vaccine. And honestly, just relax, because stress, that can actually hurt your baby. So I always tell people, when you're pregnant, just be mindful of what you think and how you feel. If you feel like eating a certain thing, if you gain weight and people talk about it, just ignore them. Just do whatever makes you happy. If just take precautions to take care of yourself and your own mental health. Like, at the end of the day, there's just so little you can control. And get your family members that will see the baby vaccinated first, especially your husband. If your husband is an anti-vaxxer, tell him, okay, you know what? We need to rethink this, because you need to keep yourself safe and your baby safe.
Okay, nice one. Thank you. Shariza, what would be your piece of advice, or what? Yeah, for you.
Just take it extra precaution, like don't go to crowded places. When I was pregnant, I just stayed at home. I didn't go to any crowded places, even mall. I didn't dine in at outside. We just stayed at home, eat at home, and the only person that we met is only my in-laws, because my in-laws, their house is just like about 10 minutes from my house. It's just that. Only then during the cases, single digit cases, masa tu baru I went out for pergi mall. Itu pun macam sekali dua, just like. But right now, with the thousands cases every day, extra precaution and follow follow the SOP, and don't think that other people yang looks healthy, they are not the carrier, because there are many people yang they don't have the symptoms. So and other than that, just be brave, be strong, and just go on, enjoy your pregnancy. Positive je.
I know, it's so cliche to say enjoy your pregnancy in the middle of a pandemic.
Yeah, I mean, even like normal pregnancy also is not easy, okay? And then in the middle of pandemic some more. Okay, Miss Emma, I mean, how about you? What would you say? What would it be your piece of advice? Yeah.
the first thing, just follow SOP. Make sure you keep your hands, keep on washing your hands, put on your face mask wherever you go. Then try to be as much be at home, just be around people that you know that they are safe and you'll be safe. Yeah, motherhood is kind of something that you are looking forward to. So you don't stress yourself too much. Nothing is too hard if you do the right thing. So keep on doing the right thing. Everything will go well. And yeah,
Enjoy your
give a
pregnancy.
very safe baby.
Yeah. Okay. Thank you, ladies. So what I would like to summarize the advice. So ensure people around you are vaccinated now that we are all in line for vaccine. Don't stress. Just relax. Take extra precaution, and of course, wash your hands and follow the SOP at the end. And the most important is enjoy your pregnancy. Did I get it right? Yeah.
Yeah,
Okay.
another thing, Tasha.
Yes, doctor.
Okay, so my advice would be very mindful of your mental health. At this point of time, you might have delivered, you might have a little postpartum depression, postpartum blues.
Mm-hmm.
You might be pregnant at the same time, your husband might not be around. If I'm not wrong, one of the comments says that yeah, PJJ right now, hubungan jarak jauh. So yes, being pregnant is really beautiful. You would want your husband to be with you, watch your little belly grow, have a baby together and stuff like that. But at this point of time, it might seem a little difficult. So the best thing you can do for yourself, for your baby, and also the people around you is be very mindful of your mental health. If you think you might feel a little depressed, if you think you're a little anxious, a little paranoid, it is fine to have all of this because you have a tiny little being inside of you. Okay, it is completely normal. But if you think it's getting the better of you, then you have to look for support. Get some advice.
Okay, so doctor, this was the question by Ira Awatif. She said that I'm pregnant with my second child right now, same as Christina. How I have to handle my emotion during my pregnancy because my husband is kerja jarak jauh right now, and you said that being pregnant itself is already a lot in the head as well, and then someone with this pandemic, and then on top of that, her husband is not always around because he has to travel and all that. So your advice to her is know when to speak to somebody, and is it just speaking to someone who went through that experience, or going to meet a doctor, or finding the right kind of doctor, or what who is that right person, or just chat, opening up? That's what you mean.
The right person is someone that can give you positive counseling. You don't want somebody to be in the same boat, but you guys are bringing both of you guys selves down. You'd be like, oh, are you depressed? I'm depressed too. Are you crying? I'm crying. You don't need that type of society, I would say. You need someone that will be able to hold your hand and grab you out of that pool. You need someone to give you positive reinforcement. Always remember law of attraction. When you attract what you want,
Yeah.
If you want happiness, you need some form of counseling, some form of help. Go and look for the right person, get the right treatment, get the right counseling done, and you will enjoy your whole pregnancy experience.
Okay, so there's yes,
Sorry,
Christine.
we did speak about this when we were getting to know each other. I think something that will help a lot and will really ease your mind is a confinement person.
Right.
Again, because you have a toddler and a second baby's coming. I did have a confinement lady with my first daughter, but she was going in and out. But for the second one, we are paying so much more because we're opting for her to stay in because I don't have a
Correct.
maid. I don't have a helper. I'm a stay-at-home mom. I've been since my daughter was born. My husband and I are the maids in the house. He does chores, I do chores. But why we wanted a confinement lady was just someone who would take a bit of the pressure off and also kind of allow your toddler, your firstborn, to settle in the role of having another sibling or becoming a big sibling a bit more smooth, because it's not just a big change for you, the lady that asking the question.
Yeah,
It's
Ira,
a huge Ira, it's a huge it's a huge adjustment for your kid as well, your kid that you already have. You know, you can't put him or her on pause. You know, their lives continue as well, but now they have to share you, they have to share your husband, they learn that this baby is completely useless and needy and clingy and needs you needs the mother all the time, but she also needs the mother all the time. So the thing that would really relieve a lot of your pressure is definitely a confinement lady. So I already actually got that. That's the only thing I got sorted out, because I am so last minute. Even with my daughter, I gave birth at 38 weeks. I still didn't have a cot. My cot hadn't arrived because I just ordered it. So
Oh, wow.
with this,
Okay.
so with this one, I was telling my husband, the only thing I want, the only thing I need is a confinement lady, and she's going to stay in to again limit
Yes.
the in and out and
Correct.
meeting other people. And also, I wouldn't have to worry about food. I don't have to worry about baby's laundry. I don't have to, if the baby's sleeping and I want to go take a shower with my daughter, or I just want to cuddle in bed with my daughter, I don't have to worry about leaving the baby alone. So, you know, Ira, aside from yes, talking to someone, because postpartum depression is a real thing. If someone tells you it's in your head, it's not in your head.
Oh, no.
It's real. It's real. And that is why a lot of people, their moms usually stay with them, because
Right.
even the old folks, they know that postpartum depression is a thing. They call it what they you know, that feeling where you want to throw your baby out. Like, it's my mom was telling me all these things, and she said you need someone to not to kind of ease you into the role.
Correct.
And I'm sure you know, Miss Hamma is going through it. Being a role to a mother of two is even crazier than just being a mother. And it's very difficult. So another thing that will help, if you have the means, if you know you can, if you have the money to spare, just having a confinement lady or just somebody, or a family member to stay with you, someone that you trust, that can watch the baby for a bit, and you can have a bit of sanity, or just watch
Right.
it for a while. That would help a lot. It would take a lot of the pressure off, and it will kind of prepare you. Because right now I feel a bit prepared, knowing that there's going to be a lady that will
Yes.
prepare my food and do the baby's laundry, because God knows babies, I don't know why they change clothes so much. They change clothes 3 times a day for some weird reason, and they go to
Yeah.
the toilet like 10 times a day.
Yeah.
So this does relieve a bit of the pressure, and especially if your husband's not around,
Yep.
I really salute you.
Correct.
Because my husband was doing night changes. He couldn't breastfeed, so I breastfed, but he was doing night changes. So this is something that will really help if you have another lady that is with you, or just a family member that you trust is with you, to help you in these roles, and also giving your partner that time to adjust.
So you're saying that you did mention to me, if it permits, the bidan itself, the confinement lady itself, well, if it permits lah, live in with you, so it reduces
Yes.
how to say,
It's-
doctor,
it's
contract cross.
Like just because you know, when they go home, you don't know
Yeah.
where they go, you don't know who
Correct.
they meet, you don't know where their family members been. So with my first daughter, I didn't have that worry. My confinement lady would come at 8, 9, and then she'd go back at like 12 or 1, which was nice, because we were not used to helpers. But then with the second baby, my biggest worry would be this person would be in contact with me and my child all the time. And it's just another risk that I didn't want to take. So you know, and I did pick a proper company and everything. So I'm sure they run through their tests and everything. They've got really good reviews. So all I care about is just to make sure that my baby is safe. Again, that's all we want, right? And hopefully by then, if everybody's vaccinated, the worry is much less.
Yes.
Yes.
Okay, so just a sharing by Ara Lavida. She said, it is hard to go for checkup without my husband. This is her sharing her experience lah. Something like what she already had her child, so it's something similar to what Shariza and Hema went through. For my first child, I had my husband with me every step of the way, but this time I had to do everything by myself. So I'm sure Shariza, you know what she means, right? Masuk the klinik kesihatan, check up sorang-sorang. Of course, maybe sedih a bit lah inside, right? First child, someone for you, right? And then, then I had to go for further checkup in the hospital. Had to walk long way alone by myself. My husband can only drop me at the lobby. Then after that, I had to wander around with my big baddie alone. So that's what she shared. So did you similarly, Shariza, you experienced the same thing, right?
Yeah.
Sama lah.
Yeah.
Okay, one last question. Do you have tips on how to help firstborn to adjust to their new role, because she's the one that's expecting the other one? Yeah. Anybody?
Miss Selma, do you have any? Because you're actually already going through it now.
Yeah, Miss Hema, what would you say? How did you help your daughter to adjust to the new role with your newborn son?
We are still ongoing. We are
Ongoing.
still ongoing with that adjustment. It's just that she needs her attention. So I'm
Yeah.
actually staying away from my. I mean, we are staying alone here.
Mm.
But after delivery, I was with my mom. She was the one like helping because my daughter I sent to her when I was working. So my mom is a really really huge strength for us right now.
Yeah.
So with her around, slowly the baby also can adapt being with the sister. You know, she keep on shouting and he needs to sleep, but then yeah, he's getting used to it.
Mm.
And if both cries together, then I at least have my mom to calm another person, and then I take care of another.
Mm. Okay.
So it's not easy, but it's not impossible as well.
The
Okay.
thing
Things
that
can be
you
done.
need to remember, kan,
Mm.
especially when they have a older kid and then they have a small little thing.
Mm.
For the little minds, they are very curious. You know, when they bring in something new for them, it's just a play toy. So instead of pushing them away, you
Mm.
don't do what you're supposed to do is bring them in, ask them to be part of it. You know, you can give them a little baju or something like that, just like, you know, try and help to put it on. At one point, they will get tired of this and they'll run away. So that's what you can do. You don't push them away. The more you push them away, they'll feel neglected.
Mm.
Then comes in the jealousy, and you just wait until you find a napkin in your newborn's mouth because they will do this kind of little.
Wow.
They are very. They are. I wouldn't say naughty. They are just very curious. So when you push
Yeah.
them, like, what are they trying to hide from me? You know. So you try to bring them in, get them to brush the little hair,
Mm.
sure that you don't leave both of them alone. I've seen many cases coming in with a cotton bud up the nose and a little pea up
Wow.
the ear. So these kind of things you have to be very careful with.
Jealousy lah, that's all right. It is jealousy? Or
Yeah.
maybe not jealousy lah, like don't know. Let me
What's
see.
different?
Let me do something and let's see how my parents react to this. Right?
And
Yeah.
also, Shasha, I was
Yeah.
telling you, right? A
Hmm.
lot of people will say, "Oh, see, you're not mommy's baby anymore." They
Yeah.
always say that
Oh
to
my
the firstborn.
God.
And the moment I hear someone say that, I turn around, I'm like, don't say that to her. Because,
Yeah.
like I said, our pregnancy was planned. We actually asked her. So my daughter,
Mm.
she's very verbally advanced. So you can talk to her like you talk to an adult. So we actually talked to her. We asked her, we're like, do you want a baby? And she was like, yes. I'm like, no, you don't understand. This is not the baby that you see for a few minutes. This is a baby inside the house. It's
Mm.
going to be your baby, I tell her. She's
Yes.
like, and to process this in her little, she's almost 3, she's 3 this year. So to process it into the brain, I could see her like fire, her neurons are firing, thinking, what does mommy mean by that? So, but then she actually said yes. And she was actually the reason I found out I was pregnant. I didn't know I was pregnant. She was lying
Oh.
down on my belly and then
Huh.
she said, Mom, you have a baby in your belly. I said, no, I don't. She's like, yes, you do. But
Wow.
but you know, she jokes around like putting babies
Uh.
in her belly and she says she's pregnant. So I'm like, does daddy have a baby? She's like, no, daddy doesn't have a baby, only you. And I actually had to grab a pregnancy test because I didn't have any. And I ordered it online and I actually took the test. It was like one of the cheapy tests because that was the only thing available.
Right.
And I was actually pregnant.
Pregnant.
And I turned out to her, I was like, how did you know? She's like, I know you have a baby. So
Oh,
it was nice.
goosebumps.
And it was
Goosebumps.
nice because, like, you know, like Dr. Guna said, getting them involved, I felt like my daughter was already involved from the very first moment because I had no idea. I was already 8 weeks pregnant at the point. I didn't even know. And Dr. Guna, that's such a good point you made up because my daughter actually rubs my belly with oil every night.
Wow.
And her baby sibling, every time she touches my belly, I swear the baby is like moving towards where she is. So that's one of the ways that she's involved right now with my belly growing is her rubbing my belly with my oil, and then I make her sing to the baby, and she's always a part of it, never feeling like this baby is just me, daddy, and baby, and then you, me, daddy. Is the 4 of us together. And then she's so excited when my mom buys the baby little float. She's like, is that mine? Because it's too small. I'm like, no, it's not yours. It's baby tiny. That's what we call him. Baby tinies. And then she'll be like, okay, I'm going to put it away for baby now. And then she'll like pretend to fold it and then shove it in the cupboard. She means well. She means well. But yeah, being involved in that sense, even when you're pregnant, the kids can definitely be involved. Like my daughter, she finishes my oils like she drinks water because she just suka-suka hati, and then she'll rub and then she'll be like, it's not enough, it's not enough. I'm like, it's enough, no more oil. So if I still get stretch marks, I don't know what to say
What to
because it still
say?
rubs my belly so much.
Right.
So yeah, being
Okay.
involved is a huge point that Dr. Guna made.
All right. Okay. Thank you, ladies. We'll be moving on to the next topic with Dr. Guna on touching on fertility. So thank you, Christina. Thank you, Shariza and Hema, for your time. Enjoy your babies. Enjoy your pregnancy, Christina. I mean, I don't need to tell you this
Thank you.
anymore. Lah. Yeah, you look like you're having fun. So thank you, Shariza. I mean,
Thank you so much
Shariza's
for having
baby's name is so beautiful. Her name is Chinta. Can you imagine? Oh, so cute, right? Okay, and thank you, Hema, for your time again.
I can tell that Miss Hema is actually I can tell that she's like rocking her baby like this.
Are you rocking the baby?
Yes, I can tell.
Okay, okay.
And I
Right.
haven't heard a squeak.
That's why. So you're really good at it,
Yeah.
Hema. Okay, thank you, ladies. Goodbye, and Dr. Guna, please
Bye.
stay in the session, and we'll move on to fertility. Bye. Thanks.
Thank you so
Bye.
much. Bye.
Thanks.
Thank you. Bye.
Bye. So back to you, Dr. Guna. You and me, Dr. Guna. So we're going to be touching on this topic of fertility. Fertility in Bahasa is did I get it right? Kesuburan, right? Proses kesuburan. Yeah, this is more on for people who wants to get pregnant and dah kahwin 2 years tak mengandung, and then immediately terus people will think that IVF ke IUI, right? That's the first thing. But chatting with you, doctor, I mean, me myself being a mom, I was so surprised that it's actually not just that. It's just too fast that I realised, like what you mentioned, doctor, like kahwin 1 tahun tak dapat anak terus thinking of IVF. That's what people have in their brain, because I think IVF and IUI that term has been branded very much so, in online, in the digital world, and in the digital platform. Sorry, that's what I'm trying to say. So coming from you, your experiences, doctor, you have a good portfolio in a sense of your patients coming in. They come in with the problem of not having proper period cycle, and then you ask them. You mentioned this to me as well. You shared this, and you ask them, why are you suddenly looking into this, right, doctor? And then they mentioned that they nak dapat anak tapi belum. But then you check period tak teratur, not having irregular menses. So doctor, before we go there, right, fertility and IVF, can you give a summary why people think of it immediately? Can you give a summary in terms of that?
Okay, so when you talk about, please excuse my background noise. It's kind of raining here actually. So the reason why people would think about IVF when you talk about infertility, because you hear all those success stories where they would go for IVF and then you have twins, and then you go for IVF, you have triplets, and then everyone will be thinking that, okay, fine, you know what, 2-3 years I'm not getting pregnant, so I'm going to go for IVF. One shot, I'm going to get a package and I'm out of this, So that's the reason why most of the time they would go for IVF. When you ask them, most of my patients, when they come in, they'll be like, okay, I've been married for 2-3 years now and I'm going to go for IVF. What do you think is the right option? Should I not, and stuff like that. When I ask them back, what do you think could be the reason behind it? Why are you looking for IVF at this point of time? Have you gone for any type of screenings, any form of tests and stuff like that? And they would be like, no, I did not. So basically, like you said, the social media thingy has kind of implanted a little chip saying that infertility, IVF. So,
sama dengan infertility, sama dengan IVF. Even if it's like 6 bulan kahwin or 1 tahun, people straight think of that. And it's not cheap, right, doctor? It's not.
It's not cheap. At this point of time, you can spend up to 30,000 ringgit, and that is for a basic IVF. But now, due to this COVID pandemic, there are some centers, they're kind of lowering the price, and now EPF allows you to take out 10,000 ringgit, and it's not as easy as it sounds. You can't really get the entire 10,000 ringgit out. You get it out in in amounts, and you have to have the solid proof for it. You need to have a doctor's recommendation for it. So yeah, you really need to know what is the reason behind your infertility. You would have to go through a few testings. So if you look at here, I have a small little paper. So the first thing you got to do is you have to go for your history examination. History, not examination, history taking, as in when a patient walks into a doctor's clinic, you need to know regarding their menstrual history. You start with the menstrual history, and then you move on regarding their marital history, as in how sexually active are they,
Right.
how many times in a month, and so many things in between. And then you would go on to the physical examination. Physical examination, you really need to know whether the patient has proper, what do you call that, when you're doing the scans and under the investigation parts, you do the scans. When it comes to the guy, you do the physical examination. You want to make sure the testicles are there, they are equal, are they small, are they big, and those kind of things, so many things in between. Then you move on to your investigations. When you come to your investigations part, is the scan. You have your tube patency test, and then you would have your semen analysis, and then you would have hormonal checks. So many things in between again, and then you would move on to changes in life. Let's say, I think that shouldn't be an issue. You're getting pregnant naturally. It is just a matter of a little bit of changes, healthy lifestyle, good food, a bit of pil kesuburan, they would call it. Usually it's clomid lah. So
Yes.
this kind of medication, let's just try. Let's just see if they can respond to this type of medications. If your periods are irregular, you don't know how to time your ovulation. That is the biggest concern when you talk about irregular menses. Yeah, you won't know how to time your ovulation. So even that, you have to make sure you put them on the pills, you get them started, and then if you can't, after a few cycles of clomid, then you move on to IUI. Only then. That also, you have a few things that you have to get it checked, which is your tube patency test.
Yeah.
Right? If your tube is not patent, there's no point of IUI. You're just going to be wasting 3,000 ringgit.
What is tube patenting? What does that mean?
Okay, so tube patency, for you to get pregnant.
Sorry, doctor. Whose tube? The female's tube or the male's tube? Okay, because a little bit confused there.
Both has tubes.
Yes.
Okay, so when you talk about tube patency test, it's usually in a female. It's
Right.
called HSG in short, yeah. So what do? Is that they would insert a dye kind of thing into your cervix, where you want to see if the fluid kind of spills out on the either end of the fallopian tube.
Right.
If there's a spillage, you are good to go. That means your hose is clean, your pipes are good, and everything can go in, right? Let's say your tube is not patent, which means there could be blocks, or your tubes are too narrow and stuff. That might be a little difficult for you to conceive naturally or even through IUI, because the sperm cannot meet the ovum at the end of the tube. So many things in between you've got to think of before even going for IVF. Okay, so when it comes to guys, yeah, getting their tubes checked, the best way to do is doing a sperm analysis, just to find out if you have enough sperm. Are they motile enough? Are they active? Are they normal looking? A sperm should have one head, one neck, and one tail.
Right.
Then under the microscope, when you look at it, they might have two heads, they might have two tails. Those kind of things are not good enough for a proper embryo formation. So let's say you have done every testing, every screening, and you are good to go. Then you would fall under the category unexplained infertility.
Right.
That's when you can think of IVF.
Right.
Because it does increase your chance by 40 to 50%. 40 to 50%. Nothing is going to be 100%. You spending 30,000, is it worth the risk? Are you willing to pay 30,000 ringgit for a 40 to 50% of chances of success story? That is entirely up to the couple.
Couple. Okay.
So when you talk about studies lah, when you talk about studies have shown that without treatment for unexplained fertility, you can get pregnant about 2% naturally with no help, no intervention, nothing. Okay, so when you talk about IUI, the percentage goes up to about 4%. Okay, and then let's say you treat it with medication, you treat it with IUI plus medication, that goes up to about 8%. And further testing, further screening, everything is done, the IUI percentage can reach up to 20%. And with IVF, like I mentioned earlier, it can go up to 40 to 50%. And that is one of the reasons why most of them would resort down to IVF.
Right, because of the percentage is a lot higher, but it shouldn't be, what you're trying to say is it shouldn't be the first thing that crosses somebody's mind, right? If you can't, I mean, first probably get your, like what you mentioned just now, see your menstrual history, follow
Yep.
that, and then see your marital activity.
Yep.
Yeah, see how is it going first. Okay, so so someone has asked this, doctor, for irregular menses, how do you check for pregnant?
I think it could be that if you have irregular menses, how do you know if you're pregnant or not? Okay, so the best way to find out is by doing a very simple urine test at home. Okay, let it be if you have irregular menses or not, but when you are pregnant, there will be this hormone called HCG. This is what all urine dipstick tests would do, they would detect hormone beta HCG. So if it can pick up, then you are pregnant. It could be, it means you are pregnant. To double confirm, you can walk down to the clinic, get your hormones done, which is way more sensitive and way more accurate. Okay, and you can do a beta HCG hormonal check via blood. It's not through urine, it's via blood. And let's say if you could be 6 to 7 weeks of pregnant, then you can do an ultrasound.
Okay, doctor. Okay, doctor, this question I have for you. When or how does someone know? When or how can they know if they are infertile? Is there any physical signs or something that happens in your body that you can see that? Or is it something that you have to go and get labs and all that, lab tests done?
Okay, when you talk about infertility, most of the time they would be thinking about irregular menses. When you talk about irregular menses, the first thing comes to mind is, am I going to get pregnant? Okay, so for some patients, they are lucky enough they don't have to redo their entire cycle. For while they are trying, and they can get pregnant naturally. Body signs, you can look for hormonal changes. If you have too much of acne, too much of hair on your face, you're putting on too much of weight at one point of time, despite good eating habit, you would see, you would feel too heaty, too cold, you feel like, you're not adjusting to the surrounding. These are the little telltale signs that can touch on PCOS. Everyone knows PCOS, polycystic ovarian syndrome. You would need to go into the clinic. The best way to actually confirm if you do have issues is getting yourself checked, do a hormonal screening, get a pelvic ultrasound just to see your ovaries if they are fine. In this way, you'd be able to tell for sure if you have any form of infertility issues.
Okay. All right, doctor. I think we've touched everything about fertility for now. So we will be moving on to the next session, which is talking about periods. So for everybody here, if you know any, like your young family member in the house, they can all now listen in to some myths that we will some myths that we'll talk about pertaining periods on a more clinical and also a more laid back approach to periods. So with that, I'll invite Miss Elaine. Hold on, yeah. hold on. We're connecting to Elaine. She's the CEO of Anya Technologies in Berhad. Hi, Elaine. Hi.
Hi.
Hi,
Hello.
thank you for joining
Hello.
us.
No
Okay,
worries.
okay. So Elaine, as I mentioned earlier in the show, she's the CEO of Enya Technologies in Berhad. So if you don't already know, Enya is the all-new, affordable, holistic, and really cool pads that I'm really excited to try next. And it's made out of organic cotton. So ladies, if you have another device beside you, you can actually check them out right now at www.enya.my. And
Yeah.
the promotions that are running for Enya is currently running at the bottom of our screen. And so with Elaine, with Elaine and Dr. Guna, we are going to be touching everything pertaining period. So before that, Elaine, can I have you explain a little bit about how did you come about to like creating and wanting to have this product of yours? Why was there the thought of getting into this market?
Oh, I see. Okay. Thanks, Shasha, and
Mm.
for everyone that is present today. My name is Elaine. I'm from Enya. So basically, in accordance to your question, I myself have very, very sensitive skin when it
Right.
comes to my vaginal area. So I used to use commercial pads. The ones that are in the market right now are Kotex, Libres, Laurier. These are the big brands that are in the market. So the brands like these, I tried using them on and off, just switching here and there. But I didn't question why do I feel uncomfortable? Why do I have rashes? Why do I feel itchiness? I just continued using them because I thought it was normal. Then until one point, I went to the gynae to just check up to see what's wrong. Apparently, it was the pads that I used. So I tried the fragrant ones, and it wasn't very suitable. I believe for me. So after that, the gynae recommended, Elaine, you should use pure cotton pads instead, or you can try the overseas imported ones that has the word organic cotton onto them. And so I went to try it, and after that, my rashes and my itchiness and my cramps, vaginal cramps, they're all gone. So
Wow.
yes, just from trying them, and it's miraculous for me because like I've never felt so comfortable during my period before. every month is just like excruciating pain and things like that. It's something that I don't look forward to. So
Right.
after I use it, I continued using it, but I realized it burned a huge hole in my pocket because it's not cheap. The organic cotton ones are not cheap. So I didn't really thought about it until this conversation that I had with my business partner in the car, and we were talking about subscription model and how subscription will be the new lifestyle, of how we pay for things, how we purchase things. So we were just talking about what are the suitable products to be done using this subscription model. And we thought about sanitary pads just instantaneously like that. And from
Yeah.
that day onwards, from that moment onwards, we never looked back.
Right.
Yeah, we started our research and found a very reliable supplier to manufacture our things, make sure the R&D is correct. And after that, we've launched like a survey to a lot of the friends and families, friends of friends out there, to ask them just one question: what is your ideal pad? And a lot of them come back and say, I want my pads to be comfortable, I want my pads to be affordable, I want my pads to be cool, and yeah, they want like the cool factor nowadays. It's like you want to be associated with like a cool brand.
Right. Yeah.
So that's what they wanted. One of them even say like, oh, I want my pads to have like some branded thing on the pad. And I'm like, okay, how is that relevant? But okay.
Something to appreciate what is have been our periods have been branded like the bad thing, the disgusting
Yes.
thing, and all that stuff. So it's inevitable for all of girls, for all of us ladies to get our periods. So
Yes.
I mean, with Enya, I think what you're trying to say is that you're putting some spark into having or looking forward to have my periods, because then I can use something
Yep.
nice. Yeah, okay, I understand. Okay.
Exactly. And since that day, we've launched the first product, which is Enya Premium. It's like this holographic box over
Yeah.
here.
I
Yeah,
love
it's this
this. I love
holographic
this.
box.
Yeah.
Thank you, thank you.
Yeah.
Yeah, so that's our journey so far, and since then we've launched many other product variations, panty liners, heating patches, and soon there will be overnight pads and maternity pads. That's pretty much about it.
Okay. Okay. Okay, Anya. So I have to ask this. When it comes to caring for our periods or caring for ourselves as women, right? We have,
Yep.
steps to care for our breasts. How should we look after our breasts and all that stuff? But is there such thing as period care if you were to, put into, step by step? Is there any period care step by step that you are able to share?
I'll definitely try my best, Sasha.
Yeah, sure.
So, I think period care, it's part of self-care routine. Self-care routine, whenever we go on, Instagram or Facebook, a lot of it has to do with skincare routine, relaxing, things like that. But mental care, mental self-care is also part of self-care, so as period care. So period care more or less means, you pay more attention to your body, you pay more attention to what are the products that you use during your menstrual phase, and your emotions as well, addressing your emotions, and also just treating yourself better during that time of the month. It can be exercising, even though like a lot of people say you shouldn't exercise, but it's okay to do so. um how you say, maybe investing in a bit of time to, sleep early. I know a lot of us work from home. Our schedules
Up and
are very
down.
messed up. Yeah, very messed up already. You don't there's no cutoff time already, so it's very important to know that, because every month when you have your period, your body is your body is menstruating. So I heard the gynae told me that it's sort of like it's healing in a way, like you will feel very tired as well all the time. I think a lot of the girls and women out there can vouch. We do feel very tired during period. So it's super important to let people to let the people around you know that you have period. I think it's important also to let them know, especially
Right.
like your spouses, so
Uh-huh.
that they can care for you a bit more.
more.
They can tolerate, and they can be a bit more understanding.
Sorry, Dr. Guna?
Additional
Sorry?
chocolates.
Yeah lah, throw you chocolates, give you chocolates. Exactly, Dr. Guna.
Okay.
Yes, so that is a very brief nutshell of what sort of period care is.
Okay, so it's exercise, sleep early, care for yourself, and most importantly, I think I agree with this as well, let the people around you know that you are menstruating, that something is happening, it's coming out.
If I'm not wrong, I think there's a news lately saying that one of the white moms are getting the boys to carry around pets. Have you heard about it? Yeah.
Oh my God.
It's
That's sweet.
Yeah, because I don't get the taboo behind this whole period thing. Your mom gets it, your wife gets it, your sister gets it, your girlfriend gets it, your wife gets it, your daughter will get it too. And
Yeah.
I don't get the part where period. It's I don't know. My
Because-
husband carries my pet also.
Oh my goodness,
Really?
so sweet.
That is amazing.
Your husband,
That's
go.
amazing.
That's good. Yeah.
He doesn't feel girlified or something like that. It's just that he knows. Okay,
I like that
when
word.
it is,
Yeah.
I'm going to run. The reason behind it is I'm not going to run into 7-Eleven or Watsons and get you your pet. So I'll carry it
I'll
for you.
carry the pet for you. Wow, amazing. I wonder, does he put inside his wallet
Love
or how?
No lah, it's in the car lah.
Okay.
Why put in the wallet so kecil?
And that's what I was thinking. Okay. So, I think this is because we have been living in this world. I don't know whether it's an Asian thing, but we grew up knowing that period dirty, just because it comes out from the vagina. So yeah, right. Everything down there is dirty, but
Yep.
then when it comes to having sex, it's not dirty. It's
Yeah.
the funny thing. It's the same thing, right? It's the same place. So it's just okay. That is a
Joke actually, Sasha.
Mhm.
My brother was actually informing this yesterday. He was like, how come period blood and all this kind of thing is dirty, and but then when a kid comes out from there, it's fine to kiss.
Oh.
no comments.
Okay, how do I go about this? And I just looked at it lah. It makes sense, isn't it? Like, it makes sense.
Yeah, of
Yeah.
course. It's just period. Everything else is very nice and exciting part. What's happening down there? Your baby comes out, can kiss the baby, come out from that place also.
Oh, that place also, yeah.
That's why. Okay, I think this is something that we see even in our country. A lot of boys now, they are doing a lot of they're going down the streets and giving out pads to people. Trying to break that taboo lah. Yeah. So okay, moving along, I would like to let's get into some myths that we ourselves have been growing up listening to. So I will randomly ask both Elaine and also Dr. Guna. So this I would ask Elaine, being in this sanitary pad business, this myth: I can't drink ice water and carbonated drinks. It will worsen the pain. What can you say? I grew up with this. My mom doesn't let me drink any gassy drink. We don't say carbonated, we say gassy drink, because then it suddenly like everything will come out. That's what my mom teach me. Yeah. Yeah. So what can you say about this, Elaine?
Well, when it comes to cold drinks, is what my mom says to me as well as my all my friends around me, as well as the carbonated drinks. But later, I would like to hear what Dr. Kuna say, because after searching on Google, apparently like it doesn't really affect.
Yeah.
Right.
Yes, because when you drink it through your mouth, and then it goes. No, I mean like it goes into your digestive system. Whereas when it comes to a period, it's your reproductive system. So they won't have connection. Hopefully, you guys don't have the connection for it, lah.
I see.
So, but the thing here is that this traditional medicine said that if you were to take cold drinks or carbonated drinks, that would cause imbalance in your
Hormones?
system. Yeah, in your whole body. They have that heaty, cold kind of thing, right? So it's off balance. So that is the reason behind it. Most moms believe traditional medicine. So scientifically speaking, it should not cause any form of harm. But then if you're going to go through traditional medicine, and then you would have this putting off the balance of your whole body, and too cold, and then you would get the cramps and stuff.
Traditional medicine, but what you're trying to say is in terms of the what's the opposite of tradition? The mainstream medication. I mean, your line of work, doctor. There's no scientific. There's no reason behind it, right? But you yourself, Elaine. I mean, you mentioned earlier that your whole idea of having Enya, building Enya, and all that is you yourself experience discomfort and all that during period, and have some trouble during period in your earlier days before Enya and all that, before you start using organic pads. Did you feel the difference when you actually have carbonated, or did you follow your mom's advice, or did you just like drink ice water and did you feel?
Well,
Did it
for
make
me
any difference?
personally, right? For me personally, right? I followed. I remember asking this question as well when I went to the gynae, and she said the same thing. And she also said why not you try not drinking caffeine as well. And I'm like, actually, when it comes to beverages, right, like the temperature, I don't really feel the difference. Like even if that particular month, even if I drink cold water or hot water more, I don't really feel the difference. It's still very crampy. It still feels very painful. But I remember for 3 months, I quit caffeine, and I quit Milo for 3 months, and I did feel the difference. To address that question, I did feel the difference if I quit caffeine and Milo. I don't know why.
Did you try back the experiment on yourself? Did you try back? Let me just try this next cycle of period, right? Let me just try and drink coffee or Milo. Did it come back?
God, after 3 months.
You try and pain came
Yeah.
back, yeah?
Yeah, it came back.
It's so
I don't know. Maybe it's just my body lah.
yeah. I think it's very subjective again, right? I feel because
Super subjective.
for me, I don't
Yeah.
feel nothing at all. To be honest, when period or not.
Coffee.
Coffee, no coffee. I don't know whether I don't pay attention to what's happening down there or what. I'm not sure. But I don't feel anything. So, like, okay, it's still very subjective to the individual itself, that female
Yes.
itself. Okay.
Correct.
Oh, I have to ask this next myth. I don't know. Washing hair when we are having period is bad for your health.
Oh, that's not true.
That's not true.
No, that's not
But this is an
true.
Asian thing. It's
Yeah.
an Asian thing.
Yeah.
Yes. True.
Asian thing.
Okay, when you talk about period, right, the first thing in your mind should come is hygiene.
Mm.
You don't want to be scratching down there and scratching your hair and then go about the whole week washing your hair.
Oh God.
Yes.
You won't know what you're doing, you know?
Oh God, doctor, you said it. Oh God, I was so taken away by it.
Preach. Amazing.
Oh.
Don't tell me you're not going to be washing your hair if at all you find some blood stains in your finger the next day.
Oh,
Right?
Oh wow.
the burn.
Scientifically, there's nothing saying that you can't wash your hair, nothing is going to happen. Again, traditional medicine could be saying that it can cool your body down a little bit more than it should, and so that might harm the balance, you know.
Mhm.
But doctor, if you say that it should cool our body down, right? Does it mean that when we have our period, we are panas? Our body heats up?
Actually, our body is a heaty body.
It's
Naturally, it should be a little
Ah.
hot than normal, you know.
I think that's why the caffeine on you, Elaine, because
Yeah.
right, because body is already a little bit heaty, and then you have caffeine. Caffeine dehydrates. If
Yeah.
I'm not mistaken, doctor, am I right? Am I getting somewhere there? Yeah. It makes
Yes,
sense.
yes.
Yeah.
Yeah,
Okay.
that makes a lot of logical sense. Once you put it in perspective, yes.
Okay, I mean a little bit sidetracked from, or someone added here. They said that wash hair cannot, cut nails cannot. I'm not too sure about cutting nails lah. Right.
Stretch yourself, and you know.
Doctor. Okay, so one question on a serious note, away from the myth a little bit, how to overcome period cramps? So on a doctor, your suggestion, and I'd like to hear from Elaine herself because she experienced it her firsthand as well.
Okay, so when you talk about period cramps, it's very subjective, person to
Yeah.
person. You would have normal cramps, and then you would see your friend walking around, jumping around like as if there's nothing that took place, but she's on her period.
Yeah.
And then you'd be another friend that doesn't come to school for 2 days or won't come to work the whole day, or even if they were to come to work and they would be all very quiet, very irritated, and because of the pain. So again, it's very subjective. If you have those kind of intense pain, yes, you can take some painkillers to elevate the pain. Again, taking painkillers, this is another myth, I'm pretty sure.
Yeah.
I wouldn't say it's a myth. It is true. Taking painkillers may affect your body, as in your health. Painkillers are known to give ulcers, stomach ulcers, you know, because of the acid release and so many things in between. So it can give you stomach ulcers. Long-term usage of painkillers and SIDS, to be very specific, and SIDS. Okay, so these kind of things you have to be very careful. You may find alternate ways. You can use heating pad. It kind of, again, you know, you go back to the heating part, the heat. So you can use heat pads. You can just lay down for some time. Don't be too stressed up. When you stress your body up, you know, you're going to every other thing. You're going to trigger the stress alarm in your body, and that is going to elevate the pain.
So doctor, if I do take if I can't handle period cramps and I do take the painkiller, some I think even my mom used to say this. So, don't take painkillers because you're not teaching your body to deal with that pain, so you become dependent on it. You know, once you pop pills, right? Then you pop the painkiller, right? Then your body will naturally be like every time period, the mind, let me find my pill, let me find my pink pill. That's the pink pill, right? That everybody, yeah. When actually, doctor, painkillers are painkillers, right? At the end, there's on another note, right?
Yeah. So the thing is that you're not going to teach your body's not going to listen to you no matter what. So the thing here is depending on how comfortable are you without the painkillers.
Okay.
So if you
Yeah.
think you're going to be, let's say you get the first day or second day of your menstruation and you're at home, you can handle, you can walk around, you are comfortable at your own home. Do you think you need the painkillers? I don't really think so. But let's say you go to get first or second day of those period cramps, but you're at work. At that point of time, you want to be a little bit more comfortable. You want to calm down the pain. You might want to pop a pill. But it basically depends on the person itself, not really the body, but the person itself, whether you're comfortable or not.
Okay. So Elaine, what were your steps or measures that you took when you have cramps, like what you mentioned earlier, back in the day when you were having harder cramps? I would say, yeah.
Okay, I'm just gonna share this from a user experience, okay?
Yeah. Okay.
No guarantee that it will work, but
Okay.
it works. It suits for me lah, okay?
Okay. Yeah.
Whenever I have period cramps, my
Yeah.
mom would boil ginger water. So it's just halia. You put inside hot water, you boil it, and then you put some rock sugar in it, and then after that you drink it, and I feel relieved a bit. Not to say like it cures 100%, no, but it's a bit more soothing. So yeah, ginger water, hot ginger water helps me. First thing. Secondly is if it gets quite uncomfortable, I would actually take my hot water bottle, fill it up with hot water, and just press it against my abdomen. Yeah, that's the second thing to relieve the pain. Third, if it gets way too painful, I would, as what Dr. Guna suggested, I will go to the pharmacy and I will get the pink pills. That is if it's way too painful. I cannot handle that sort of pain. But of course, like what Dr. Guna mentioned as well, if let's say your pain gets very, very, very painful, please go see a gynae or a doctor, because there's a lot of women experience and have endometriosis and we don't know about it. Sometimes it's just like, oh, very painful, super painful, but you think that it's normal period cramps, but maybe it's not.
Sorry,
So it's very, very good.
what was
very
that word
important
again,
to go
Elaine?
and check out.
Endo. What was it?
Endometriosis.
So that only happens when you're menstruating, when you got pain. Or how? Or the pain elevates during period timing. That is it? Okay.
So endometriosis is basically, it's like a disorder where your
Yes.
tissue that is supposed to line the uterus is found outside of the uterus. So when you have this kind of thing, it's like adhesion. Everything is kind of tugging. Just imagine everything: your ovaries, your fallopian tube, your uterus, everything is tugging. So at that point, when you're having your period, your uterus is trying to squeeze everything out. So at that point of time, when they are tugging onto other parts of your the pelvic region, it is going to give you intense amount of pain. So if you are popping pills on a daily basis for your period cramps, you have to double the dose at times or triple the dose at times.
Yep.
Do come in for a test, do come in for a scan. We need to get that checked. Naturally, periods should not cause you any form of discomfort that you cannot handle.
Yeah, because our bodies, right? How can it betray us and make us feel that much pain, right? Yeah, it makes sense actually. So if it's something,
correct.
if it's something unbearable, then that's a sign to go and see a doctor, and find out how to. Okay, sorry. There's a question. Is that safe to take Celebrex, doctor, for period cramps?
Okay, when you talk about painkillers, there's few different categories. Okay, Celebrex is usually used when you have intense amount of pain.
So don't take it when it's not bearable.
It's not going to be much of a help. At the same time, it can affect your kidney in long term.
Yep, that's true.
So if I can't bear, Celebrex is a type of drug for relieving period cramps specifically. Did I get it right?
It's not really specifically for period cramps. For period cramps, the one that we commonly use in hospital settings or clinic settings is mefenamic acid, known as Constant.
Okay.
Yeah. So this will definitely help in the muscle relaxant. It kind of elevates the period pain and all. Celebrex is a little higher. Some people they want that because mefenamic acid constant is not going to work for them. So it can help, but yes, this is one of those higher class painkillers.
Okay. All right. Thank you, doctor. So back to two more myths. Let's do two more myths. Okay, this one. Exercise while menstruating is unhealthy and can damage the uterus. So we know this is not a myth anymore because just now Elaine shared with us that how to care during period care, right? You need to exercise, sleep early, and let people around you know. That's very important. It's gonna stick to in my mind actually. So exercise while menstruating is not going to be. It's not a bad thing. But if you have pain, I think then you should consider
Yeah,
maybe,
resting.
doing yoga. Maybe it's fine. It's still exercising. Something calming. Okay. A very interesting myth. That means having sex during
Oh,
having period is unhealthy for the women and also can hurt the men.
that's not true.
It's not true.
Hurt anybody is supposed to hurt the girl and not the guy.
Nothing to do. Okay, so the dirty blood is not going to hurt the men.
Okay, so the only reason why people would talk about the period blood being dirty is because they can have some amount of bacteria. We women generally, we do have some form of bacteria, some form of fungus down there. Okay, so candida is very common in female. These are the few things that we do have, and it kind of balances out. We are not infected. It just balances out our stuff down there, right?
Right.
So let's say if you do have a dirty discharge, not period, but dirty discharge as in infected discharge, and then you go on having your period, chances are that period may they might have a little bit of bacteria and things like that, and that if it goes into the guy's penis, so that can cause some form of infection for the guy if girl is infected.
If the girl is infected.
But doctor, if that girl is infected, if the girl is infected as well, even without the period, will cause problem as well, right?
Yeah,
Yeah.
So it's not the period's problem.
it is not the
Period
period.
is not dirty.
Yes, period is not. Please don't ever say period is dirty.
Yeah.
It's only dirty because it comes down there.
Yeah, mindset only lah, basically,
Yeah,
right?
Yeah.
Ah,
Mindset.
so I think I would like to say that we should celebrate periods like how Elaine, your brand Enya itself is celebrating, and I like how it is that how you positioned it to make women celebrate, and not celebrate lah, look forward to having period. It's not like oh my goodness, I have to go and shy go and buy my pad, go to the grocery store and buy my pad, but it's something to look forward to. So I really like that part. Okay, last
Thank you.
myth. Last myth.
Last myth.
Last myth. Okay. Let's take. Okay. PMS is in your head. Period. Premenstrual syndrome is only in your head. It's being used from men against women. It's being used like hey, why are you so angry? Having PMS
I know, right? Oh God.
I wish I can just bang somebody's head when they say that.
Slap them,
It is
right?
my head. Okay, it is not in your head. Technically, somewhat it is in your head because you have the pituitary gland going up there.
Hormone.
So so this thing comes back to hormonal stuff, okay, where you would have increase and decrease in hormones. That's how you get your period. Okay, so when all this takes place, there's something called serotonin. So which affects the mood lah. So that's how you get the PMS. You're not simply saying don't kacau unless you want to kena pukul, then kacau lah.
Yeah lah, that's why.
Other than that, no, we are not simply making up the excuses. It might seem like, of course the guys might get a little like, oh, you're doing this on a monthly basis. You're doing this simply every single month. That's because I get my period every month. because my hormone cycles every month, so it's something to do with your hormones, it's something to do with your serotonin, it's something to do with the mood imbalance. You are not acting up, you're not using that an excuse. No, it's not in your head. Yeah.
Okay.
Yeah.
So
I
Elaine,
agree.
are you a type that significantly have experienced people saying that, hey, are you on PMS, or do you feel like I have some friends who like, hey, I think I'm PMSing, like they can actually say that I'm having it. Do you experience it yourself? Because for me,
Yeah.
why I'm asking is because I'm very defensive. I always say, hey, no lah, I don't PMS one. Because it's the same. But actually, I think people around me realize that I think you're gonna get a period. I myself, like, very like gung ho lah. Say I don't want to admit. But you yourself, how do
I think
you? Yeah.
I believe one of the key I think challenges, I would say, day to day, especially when running a business, is
Right.
that sometimes I find it very difficult to draw the line between personal emotions and business. So sometimes when I get too emotional when it comes to facing, certain people in the business,
Right.
then I might, a lot of people might say, like, Elaine, like, are you on your period? Like, is your period coming soon? Are you PMSing? Is that why you're so emotional? I say, no, that's not why I'm like this. We're dealing with the issue here, and this is not right. It's
Right.
not because I'm PMSing. So I do get that sort of questions here and there. Even, last time, my boyfriends, I angry for a while, then they're like, are you on my period? I'm like, I want to slap you. I'm not on I'm not on my period.
I get that a lot too. So yeah.
That's
The
why.
best
Please,
way
it's
to
like,
come out of this, right?
yeah,
PMS the entire month.
Oh, so I make up. We
make
should
it
make it
normal.
make it normal. Angry every day, right?
Everyone has to be able to differentiate, like, are you angry now because of your period, or are you just angry,
Yeah. Throw them off the throw them off a bit.
That's why.
Okay,
Yeah.
okay. All right. Okay. I think before we come to an end, is there anything else that both Elaine and Dr. Guna would like to add before I conclude today's session?
I think one of the myths also I like to address, a lot of people don't know until today.
Okay.
It's when how do I even put this in words? I'll try to. Okay. There's a myth going on also that says, like, you can't get pregnant during your period.
Yes.
Yeah, it's not like you can get pregnant even if, like, you have sex during your period. You can get that because a lot of guys, they think that when girls have period, meaning to say, like, they can just ejaculate into the body like that. It's not like you there. Maybe Dr. Guna, you can help me to rephrase it, but yeah, I like to address this because a lot of people don't know about
Don't
it.
know. I myself don't
Yeah.
know about it. Yeah.
Okay, so okay. The guy and the girl, okay, both of them can be the reason why they get pregnant during period if they were to have sex during period. The first thing is a girl can ovulate twice in a month. Okay, so they can ovulate twice in a month. So you won't know whether you're ovulating now or at the end of the month. But at the end of the month, you're supposed to get your period, right? Another thing is guys' sperm can live in the girl's uterus up to 5 days.
Yeah.
I
Correct.
thought it was 48 hours. 5 days.
You're like commandos, very strong.
Those little armies can stay in you for 5 days.
Wow. No wonder I got surprises lah.
So
My two sons. No wonder. All wrong calculation, Okay, doctor. 5 days. Wow.
yeah, so if let's say you were to, let's put it like this, if you were to have sex on your day 5 of period, which means the little thing is going to stay in you for up to day 10 of your cycle. Some girls tend to ovulate a little early. There's no such thing as every 14 only you're going to ovulate. There's no such thing. You may ovulate a little earlier, you may ovulate a little later. So let's say you happen to ovulate on day 10. Come, you're pregnant.
Wow.
So
And it cannot plan, right, that one, because it might just happen, right, doctor? It's not. It might happen this month. It might not happen next month. Can it be like that?
Yeah, it is not something that it's going to be like a cycle. Like I said, every girls have different cycles, and everybody has different body. So you might ovulate a little earlier this month by a day or two. You might ovulate a little later next month. So you won't actually know for sure until and unless you cap them.
Okay. All right. Okay. I think we've covered the myths.
Love it, love it.
Love it. I love the session today, especially this period one is very exciting. Okay. So thank you, Dr. Guna, for the very informational session that we have. Thank you, Elaine, as well.
Thank
Okay.
you.
On the other hand, I'd like to say if any ladies who wants to have a session in terms of your irregular menses or something pertaining your reproductive for women, you can reach Dr. Guna at 016-270-0943, and she is the Center Medical Director of Polyclinic MUC in Kajang, Jalan Reko Kajang. And for Enya, if you really like to try, if you're like me and can't wait to try Enya pads, get the promotion that's running right now for 3 ringgit off when you type Enya Health 21, ENYA Health 21 at www.enya.my. So thank you again, Elaine and Dr. Guna.
Thank you. Thank you,
Ladies,
Sasha.
thank you. Ladies, do not forget to tune in tomorrow at 10 a.m. where we will be speaking everything and anything about breasts. So if you have any questions pertaining how to care for your breast, or am I looking after my boobs properly, do I have cancer, do I have not cancer, am I too young to have cancer, am I too old to still care for my breast, or anything pertaining breasts, do join us. Don't miss out on that session at 10 a.m. And before I go, I'd like to read out the promotions again. Buy Enya products at RM 3 ringgit off when use promo code Enya Health 21 at www.enya.my. Enya also offers subscription for convenience, offering Enya Basics, which is pads, right, Elaine?
Yes,
Enya Basics,
yes.
yeah, for you to try out. So let's try out. I'm gonna do that first thing after this. Free by
Thank
just
you.
paying for shipping at www.enya.my simple website. MUC Healthcare is also having a special deal for ladies today, where you get free pap smear if you come in for a pelvic ultrasound, and also pap smear for only 30 ringgit. That is a pretty good deal. So the
Wow.
locations, just for this. So the locations of Polyclinic MUCs are in Bukit Bintang, Kajang, and also Labu Negeri Sembilan. Thank you again for joining us today, and I wish, if you wish to re-watch this whole session of pregnancy to fertility to periods right now, then you can watch it at MUC Healthcare's Facebook page and just rewind the live session, and that's it. So see you all tomorrow morning at 10 a.m. Bye, Doctor. Bye, Elaine. Thank you. Bye. Thank you,
Thank
guys.
you.
Bye.
Bye-bye.